Hi guys, in this video we'll be discussing about hyperemia, congestion, and hemorrhage. It's a very simple, straightforward question, uh, and there's really not a lot to be discussed about in here. Uh, so, starting with the definitions. So we're going to define three different terms over here. So the first one is hyperemia, then congestion and hemorrhage. For the first two, hyperemia and congestion, they both are referred to as an increased blood volume in tissue vasculature. The only difference is that both of them have different underlying mechanisms of how they occur. The key term is increased blood volume in tissue vasculature. So it's not the interstitium, it's the tissue vasculature. So it is the blood vessels in the tissues themselves in which you have an increase of blood volume in. And then you have hemorrhage, and hemorrhage is defined as the extravasation of blood from vessels. Now, extravasation of blood into where, it doesn't matter. As long as you have loss of blood or extravasation of blood from the vessels into any space, it would be termed as hemorrhage. Moving on to hyperemia. Hyperemia, another term or other terms for it is flux hyperemia. The term flux hyperemia is very liked by Professor Dushkova. And you also have peristatic hyperemia, which you see mainly in capillaries, as compared to flux hyperemia, which you see mainly in arteries. So, the main difference between hyperemia and congestion is that hyperemia is an active process. It is a result of arteriolar dilation. The dilation of the arteries allow for an increased blood flow into the tissue, whichever it may be. And morphologically, the tissues appear to be red because of the increased blood volume. Uh, and since it's in the arterial or arteriolar system, you see that this blood is oxygenated. That's why it has a very bright red appearance. So any organ or any tissue morphologically which appears quite reddish, you could think of hyperemia uh, as one of the things that might have occurred. Examples of hyperemia, physiologically, you could see hyperemia during exercise because of the increase in blood flow to the muscles. And this blood flow increase can be uh, up to like 15 times its resting rate, all of which is physiology. Pathologically, which is of interest to us, is mainly in inflammation. So if you remember from the general pathology overview of inflammation and all the things that occur in inflammation, one of the things that occurs is that you get an increased blood flow. You get dilation of these vessels, which allow for uh, an increased blood flow into the tissue. And also, apart from increased blood flow, after the dilation, you also have the flow rate decreases. Like the rate at which the speed at which the blood is flowing also decreases, and it's I think it's called margination. So remember that. Moving on to congestion. This is also known as passive hyperemia, and it occurs in the venous system due to venostasis. So what happens is, for whatever reason it may be, there is a decrease in the venous return. Since the venous return is decreased, it leads to accumulation of blood in the veins, and that is what is referred to as its congestion. Can be multiple etiologies. You can have localized venous obstructions due to thrombus or mass from tumors, basically, which can compress and press against um, these veins, and also you can form objects from outside the body, wearing tight clothes or having shoes or watches on very tightly. This can also obstruct the venous return in the superficial veins. Apart from that, you can have systemic obstructions, basically usually due to right side heart failure. What happens is systemic venous congestion manifested as nutmeg liver, and basically What happens over there you get is because of right side heart failure, there is a backup of blood in the systemic circulation, and that leads to post-portal, post-hepatic portal hypertension. And in post-hepatic portal hypertension, you have hepatomegaly because of there being excessive blood in the liver. And since there is excessive blood, this blood needs to shunt from the liver, and it shunts mainly to the to the splenic vein, leading to splenomegaly because of the increased blood volume over there. So one of the main findings you can see in systemic venous congestion is hepatosplenomegaly. You can also see liver damage, which can lead to ascites, basically accumulation of fluid in the peritoneum. You can see varices, esophageal varices. Uh, they're basically also venous congestion. You can see caput medusae, which are basically obstruction of the superficial venous system or enlargement of the supervenous system because of this, all of this. So these are all interconnected with one another. And then in left side heart failure, what you see is pulmonary congestion and edema because of a backup into the pulmonary circulation due to left side heart failure. Complications. So these dilated veins are at a risk of rupture and bleeding. So basically, think about mainly the esophageal varices. These esophageal varices are a really high risk of bleeding, and if these rupture and bleed, it would then be termed a hemorrhage. So you can have esophageal varices rupturing and bleeding, leading to hemorrhage. Also, since there is a backup of blood, uh, blood starts pooling up, poor oxygen delivery that can lead to ischemia, uh, lung and liver congestion. So in the lungs, you can have pulmonary edema, ARDS, right side heart failure, and in the liver, you can get is dilated sinusoids, hypoxia, steatosis, cirrhosis, portal hypertension of post-hepatic type, nutmeg liver. These are the main things you would see as complications. And these are also some, you can mention these as macroscopic findings, examples of macroscopic findings in congestion. Moving on to hemorrhage. This is basically extravasation of blood. Can be into anywhere, could be within the body, into the tissues, could be into the preformed cavities, could be externally. So there are multiple types of hemorrhages. Etiology is basically chronic congestion, damage to blood vessels, and disorders of bleeding. Disorders of bleeding is a entire separate question in pathology of hematopoietic and lymphoid system. So that could be found over there. And they can also be largely connected with disorders of primary and secondary hemostasis and disorders of collagen. Basically, uh, if you have weaker vessels because of poor collagen, lack of collagen, etc. So this can affect and can be risk factors for hemorrhages. So different types of hemorrhages. You can have an external hemorrhage. Basically, what happens over there is you bleed outside the body. Uh, and if you have a loss of around 15 to 20% of your blood volume in, in an acute manner, this can lead to hypovolemic shock. And chronically, blood loss leads to iron deficiency anemia. So, iron deficiency anemia is uh, one of the main things you should think about if you have external hemorrhages. And then you have internal hemorrhage. Internal hemorrhage is bleeding to tissues, and this can cause hematoma and jaundice as well. Jaundice is basically because of this excessive bleeding. All of these RBCs are going to be lysed up, and the hemoglobin is going to be degraded into bilirubin eventually through a process to multiple steps, and then this bilirubin would be circulating back into the blood, causing jaundice. This would be a type of pre-hepatic jaundice. And then bleeding into the preformed cavities, multiple different problems depending on the location, especially if you have bleeding into the pericardium, you get cardiac tamponade, which is could occur either because of the rupture of ventricular wall, post-myocardial infarction, or different etiologies, basically trauma, or you can have bleeding into the pleura, which can cause hemothorax, compressing against the lungs, uh, leading to breathing difficulties, and those are the main things that you should mention about hemorrhage. Uh, this was a very simple, straightforward question. Very basic. Stick to the basics. Go in a very uh, organized manner, mentioning the definition, etiologies, complications, and morphologies, if any, and in this order. And I think you should be set for the exam. Thank you.